What does metformin actually do to your body? What are the things that can go wrong when you take metformin, and how can you avoid them? What are some natural alternatives to metformin that can also lower your blood sugar? And should you even take metformin at all? I'm going to share with you everything you need to know about metformin so you can decide if it's right for you, because ultimately it's your health and your decision. I'll make everything really simple and easy to understand because, unfortunately, most doctors don't have the time to tell you anything about the drugs they're prescribing for you. Metformin is a type of medicine that's used to treat high blood sugar. But let's start at the beginning. What do we even mean when we say that your blood sugar is high? And how do you get to the point where you need to take medicine to bring it down? First of all, there are lots of different types of sugar. The regular sugar, which you put in your tea or your coffee, that's sucrose, is made up of 1 unit of glucose, which is one type of sugar, and 1 unit of fructose, which is another type of sugar. And these are glued together. When you drink that tea or coffee, it goes into your stomach, where that sugar will be pulled apart into glucose and fructose. And both of these will go into your blood. But what we measure as blood sugar is just the glucose. So the glucose will go into your blood and raise your blood glucose, which is what we call your blood sugar. When you eat foods like potatoes, bread, pasta, yam, and other starchy foods, believe it or not, the exact same thing happens. These foods contain starch, which is basically glucose attached one after another, like beads or pearls on a string. These long chains can't go into your blood. So when you eat this starchy food, it goes into your stomach, where these long chains are broken up so that the individual glucose is free and is now small enough to pass into your bloodstream and raise your blood sugar. So that's where a lot of people get confused. When we say that you have high blood sugar, we mean that you have high levels of glucose in your blood. And this means that any food that your body can break down into individual units of glucose will raise your blood sugar. That is your blood glucose. So when your blood glucose, that's your blood sugar, rises above a certain level, your pancreas releases a hormone called insulin. Your body uses hormones to send messages around your body. So insulin travels around to every part of your body through your blood. And it goes around knocking on doors, telling each of your cells, look, this is dangerous. There's too much glucose in the blood. I need you to open up and take some so the levels in the blood can come down. If you're healthy and everything's normal, when insulin knocks, your cells listen. They open up and they take some of that sugar out of your blood and into the cells, and your blood sugar comes down. As we keep on eating, and as we're getting fatter over time, these cells become stuffed and uncomfortable. You know the feeling when you've had so much to eat that just looking at food makes you feel like vomiting? Yeah, just like that. So now, when you eat, your blood glucose goes up, insulin comes along and knocks on the door, telling your cells to open up and remove some of the sugar from the blood. And they're like, no, thank you. We're stuffed. We can't take any more. And they refuse to open their doors. And the sugar in your blood stays high. So this is where we talk about insulin resistance. If insulin knocks on the door, talks to your cells and they listen and open up, that means that your cells are responding to insulin. They are sensitive to insulin. But if insulin knocks and the cells don't listen and they don't open up, that means that they've become stubborn. They've become resistant to insulin. If your cells aren't removing this glucose, this sugar from your blood, what happens? It goes and attaches itself everywhere in the body. It goes to your eyes and attaches there to cause blindness. It will latch onto your skin and make you look older. It creates a wonderful environment for germs to grow, so your wounds refuse to heal and become infected. It affects your heart, your kidneys, your sexual function, basically everything. So you really don't want a lot of sugar in your blood. But when your pancreas sees that your blood sugar is still high, what does it do? It becomes hyperactive. It produces and releases more insulin so it can overwhelm these cells and force them to open up and remove sugar from your blood. And this way, your blood sugar comes back down to normal. And this works for a while, but then the cells are so uncomfortable that they become stubborn again. And your pancreas produces even more insulin. And then your cells become stubborn. And this game goes on and on until your pancreas just can't produce enough insulin to force these cells to remove the sugar from your blood. And that's when your blood sugar starts to go up. So this whole drama has been playing out in your body for years, but you had no idea that anything was wrong until you did a blood test that showed that your blood sugar was high. So now you're left with high insulin resistance, high insulin levels, and high blood sugar. So now you have prediabetes. And as your blood sugar goes higher and higher, you progress to full-blown type 2 diabetes. Blood sugar, or blood glucose, is measured in millimoles per liter or in milligrams per deciliter, depending on where you live. They mean the same thing. It's just the same way that some countries use kilograms to measure weight and others use pounds. So I have a document you can download in the description that gives you all the different numbers for blood sugar and insulin and so on, so that you'll know what's normal and what's not. It also has a list of foods that will raise your blood sugar the most and much more, and you can get that in the description. When your blood sugar goes up, you may start to notice certain signs. You feel drowsy all the time. You're always tired. You're always hungry. You're always thirsty. You wake up 5 or 6 times during the night to pee. That's to pass urine. If you happen to pee outside for any reason, you'll find that ants will gather around the urine because ants like sugar. You might find that you can't see as clearly as you used to. And the thing about some of these signs is that we tend to dismiss them or ignore them because we feel that it's just part of getting older. So this is where metformin comes in. Metformin works in several ways. It reduces your appetite, and this can help with weight loss. It delays the emptying of your stomach. So this means that food stays in your stomach much longer after a meal. It reduces the amount of sugar that's absorbed from your gut after you eat into the bloodstream from the carbohydrates in your food. It also decreases the amount of sugar that your liver releases into the blood. And it helps your cells to respond better to insulin so that when insulin comes along and knocks on the door, they open up so your blood sugar can come down. When your blood sugar goes up into the pre-diabetic range, some doctors will tell you to change your diet, get more exercise, and lose weight, while others will prescribe metformin for you. When your blood sugar goes up to diabetic levels, then your doctor will probably prescribe metformin alone or combined with another drug to bring your blood sugar down. You usually get metformin in the form of tablets, 500, 850, and 1000 milligrams per tablet. You can also get it in liquid form, and you can take metformin up to 3 times a day with a maximum dose of about 2500 milligrams. There's also what we call the extended release version of metformin. And the advantage of this is that you only need to take it once a day and usually at night. Metformin is often combined with other medicines to make them more effective. And a lot of the time, when you see met or meta in the name of a drug for blood sugar, it might contain metformin. For example, you have Galvus and you have Galvus Met. And probably the most well-known brand of metformin is glucophage. Metformin is the most commonly prescribed diabetes medicine in the world because it has several advantages compared to some of the others. Metformin is among the cheapest of the diabetes medicines, and you can basically get it anywhere in the world. Seeing as it's a medicine that you swallow, there are no needles or injections involved. A lot of diabetes medicines actually make you put on weight, which is making your diabetes worse in the long term. Some people even lose a little bit of weight while taking metformin. And then, compared to other diabetes drugs, metformin is less likely to cause your blood sugar to drop dangerously low. That's hypoglycemia. When you start taking metformin, you may or may not have side effects. And what increases your risk for side effects from metformin? You're more likely to experience side effects if you're taking very high doses of metformin, if you have liver disease, kidney disease, heart disease. And some people who don't even have any of these diseases simply cannot take metformin. No matter what they try, they have severe side effects. For some people, the side effects may subside over time. And if they do return, it's often when the dosage is increased. And some people have no side effects at all, and many of them have been taking metformin for over 20 years without any problems. So, the most common side effects of metformin are usually gastrointestinal issues, right? This is the most common because since metformin is taken by mouth, digestive issues are going to arise, definitely. So you might have nausea, you might have vomiting, you might have stomach pain, you might have constipation, you might have gas and bloating, that burping and farting more often, and you might have diarrhea. And this can be so bad that people won't take metformin if they have to leave the house. And up to 50% of people have some degree of diarrhea when they're taking metformin. You may have an unusual taste in your mouth, which may be a metallic taste or a sour taste, especially if you're having acid reflux. Some people actually have reduced taste when they're taking metformin. You may have general weakness and tiredness. You may have aching of the muscles. And metformin can cause low blood pressure, especially when you stand up quickly, which makes you feel dizzy. This is especially dangerous as an older adult if you're already having problems with your balance because this can easily lead to falls. Another problem you may have with blood sugar lowering medicines is that the blood sugar can drop too low. Metformin rarely causes dangerously low blood sugar, but it can happen in certain situations, like if you're taking metformin on an empty stomach. Don't do that. If you're using it with other blood sugar lowering drugs, that might happen. If you're doing vigorous exercise after taking metformin, and if you're drinking a lot of alcohol while you're taking metformin. Metformin can also reduce the absorption of important vitamins and minerals from your gut, including vitamin B12, folate, and calcium. Some less common side effects of metformin include chest pain, frequent infections of the nose and throat, persistent cough, excessive sweating, and headaches. So, how do you prevent these side effects from metformin? If you're starting metformin, start with a low dose and increase gradually. So you start with maybe 500 milligrams at night. Taking it at night means that you might be able to sleep through any discomfort. After a week, then you add 500 milligrams in the morning, and you would slowly increase stepwise the amount and the frequency until you reach the required dose. You can also switch to the extended release of metformin, because when you take regular metformin, it kind of goes into your blood all at once. But the extended release form goes into your blood in small quantities over a period of time. So that tends to cause fewer side effects. Never take metformin without eating. Wait at least 15 minutes after eating before taking it. And this reduces the nausea, stomach pain, and all these side effects in the gut. Lactic acidosis is a life-threatening condition that can occur if you're taking metformin. It is rare, but you may have vomiting, diarrhea, extreme fatigue, and muscle pain. You may have some degree of confusion where you don't know where you are or what time of day it is, and you might have shallow breathing. And you're more likely to have lactic acidosis from metformin if you're elderly, if you're taking high doses of metformin, if you have kidney problems, if you have an infection, and if you drink a lot of alcohol. If you have decreased kidney function, you may have to stop taking metformin before doing some specialized x-rays and CT scans. So let's start with inositol. Inositol helps your body to listen to insulin, making it easier for your cells to bring that sugar in where it belongs. Most people start with around 2 to 4 milligrams per day, and inositol has a sweet taste, so it's really easy to take. You can take the powder form mixed with water, or you can take it in the form of capsules. Berberine helps your body use glucose more effectively and also reduces the amount of sugar that your liver makes. This is similar to how metformin works. In fact, some studies have even shown that berberine can be just as effective as metformin when it comes to lowering blood sugar. Berberine can also help with other health problems like high blood pressure, high cholesterol, and high triglycerides. Most people take berberine at about 500 milligrams 2 or 3 times a day, and it's best to take it with meals so that it can help to manage the blood sugar spikes that come after eating. Bitter melon works like insulin, knocking on the doors of your cells and helping sugar to get inside, where it can be used for energy, and it reduces the production of glucose in the liver. You can find bitter melon in different forms. Some people drink it as a juice, though fair warning, it's called bitter melon for a reason. And the typical dose for bitter melon extract is 500 to 1000 milligrams per day, and you'd usually divide this into 2 or 3 doses. Fenugreek works by slowing down how quickly your body absorbs carbohydrates, which means that it can help prevent those big blood sugar spikes after meals. To use fenugreek, you can take the whole seed at 10 grams of soaked fenugreek seeds consumed daily on an empty stomach. You can use the powdered form, so that's about 5 grams of fenugreek seed powder twice daily before meals. And if you're using fenugreek supplements, the standardized fenugreek capsules often range from 500 milligrams to 1000 milligrams, and you take that 2 to 3 times a day. Gymnema can actually reduce the amount of sugar your intestines absorb, which means that less sugar ends up in your blood. Another great thing about Gymnema is that it can help curb sugar cravings and make sweet things tasteless. You can take Gymnema as a supplement, and the typical dosage is around 200 to 400 milligrams a day. And then remember that just because a particular supplement works for your sister or your uncle or your friend doesn't mean that it will work for you. And then on the other hand, just because someone has, someone has had side effects from, say, berberine, it doesn't mean that you have the same side effects or that you'll have any side effects at all. The next thing is that these supplements work best when they're part of a healthy lifestyle that includes being careful with what you eat, getting good quality sleep, and controlling your stress levels. When you have high blood sugar, your body is trying to tell you that you have a problem. Your cells are uncomfortable. They have too much fuel. They're stuffed full. So they're resisting the action of insulin to protect themselves. When you take metformin, you're basically forcing these cells to open up when they don't want to. And when you stop taking the metformin, your blood sugar goes back up. It's like you have a room full of rubbish, and instead of throwing out the rubbish, you hide it under your bed. Even though you can't see the rubbish, it's still there and it's still smelling. So you need to treat the roots, the underlying cause of your insulin resistance and high blood sugar, so that you have a long-lasting solution that doesn't involve taking more and more drugs. And I'll show you how to do that in the next video.